Hello everyone. In this video I will demonstrate to you the general features and articulations of ulna. This is the ulna, which is situated medially in the forearm, and it is homologous with the fibula of the lower limb. It is a typical long bone, so it has two ends, an upper end, lower end, and the shaft. The upper end is hook-like. We can easily identify by the presence of two processes. This process projecting superiorly is the olecranon process, and this projection projecting forwards is the coronoid process. In between olecranon and coronoid process there is a notch, which is known as the trochlear notch, and on the lateral aspect of coronoid process there is another notch known as the radial notch. In the lower end, we will find rounded head. So this is the head of ulna. And posteral medial to the head, this projection is the styloid process. This is the shaft between upper end and the lower end. The shaft has three borders. The sharp crest-like border is the lateral border or the interosseous border. So this is the interosseous because it will face towards the interosseous border of radius. So this is the lateral border. Place it literally. In order to determine this side of ulna, we must know that the upper end has olecranon coronod process and the trochlear notch, and keep the radial notch on the lateral side of the coronoid process. The sharp crescent-like border is on the lateral border, and in the lower end, the stylar process should be on the posterior media side to the head. So this is the left side ulna. Now coming to the upper end, the olecranon process has 5 surfaces. This is superior surface. This is the anterior surface. This is the medial surface, lateral surface, and this is the posterior surface. The posterior part of the superior surface is rough. Medially, the medial surface continues with the medial surface of the shaft. The anterior surface is articular, and it forms the upper part of the trochlear notch. The trochlear notch articulates with the trochlea of the humerus. So here we can see this is the trochlea present in the lower end of the humerus, which will articulate with the trochlear notch of the ulna in such a way. And we can see here the olecranon process fits into the olecranon fossa present on the posterior aspect of the upper part of the trochlea in extended elbow. So that is the anterior surface, and on the posterior aspect, there is a triangular subcutaneous area, which will be separated from the skin by a bursa. If we see this apex of the triangular area, it will continue down with the posterior border of the shaft. So these are the 5 surfaces of olecranon process. Now coming to the coronoid process, it has 4 surfaces. First is the superior surface, which forms a lower part of the trochlear notch. Then there is a medial surface, which will continue with the medial surface of the shaft. Literally, in the upper part we can see the notch. This is the radial notch, and we have already seen the radial notch will articulate with the circumference of the head of radius, and from superior radial are joined. Attached to anterior and posterior margin of this notch is the annular ligament. In the lower part, there is a depressed area to accommodate the radial tuberosity, and just behind this, there is a crest running down. This is the supinator crest. Anteriorly, the anterior surface of coronoid process is rough, and in the lower corner, it forms a rough tuberosity. It is known as ulnar tuberosity. So these are the main features of the upper end. In the lower end, there is a rounded head, and posteromedial to it, there is a styloid process. Behind, between head and styloid process, there is a groove, which transmits their tendon of extensor carpi ulnaris. Now in the shaft there are 3 borders and 3 surfaces. The sharp crest-like border, the most prominent, is the interosseous or the lateral border. Then there is a anterior border which is thick and rounded. It starts above from an ulnar tuberosity and goes down to styloid process. And behind, posteriorly, this is the posterior border. It starts above from the apex of the triangular subcutaneous area of the posterior aspect of olecranon process and goes down up to styloid process. So these are the 3 borders. Now coming to surfaces. So this surface between anterior border and interosseous border is an anterior surface. Between anterior and posterior border is the medial surface. And between interosseous and posterior border is the posterior surface. So this posterior surface, keep it behind. This is anterior surface in front. And this is the medial surface. Now coming to the articulations of the ulna, the radial notch of the ulna, which is on the later aspect of the coronate process, will articulate with the circumference of the head and form the superior radial nerve joint. Whereas lower down, there is ulnar notch of radius, which will articulate with the head of ulna and form the inferior radial nerve joint. So these are the 2 superior and inferior radial nerve joints. And in the middle, there is interosseous membrane, which is attached to the interosseous borders of ulna, and the radius, which forms a middle radial joint. The direction of the interosseous membrane is downwards and medially, from radius to ulna. Also, the trochlear notch of the ulna will articulate with the trochlea of the humerus, whereas the capitulum of the humerus will articulate with the superior surface of the head of radius. So this forms the elbow joint. Behind we can see the olecranon process accommodates into the olecranon fossa during extension. But when we flex the elbow, so the coronoid process fits into the coronoid fossa of the humerus, whereas the head of the radius will fit into the radial fossa of the humerus. So here we have seen anterior in the lower in. There are 2 fossa. Medial is the coronoid fossa, lateral is the radial fossa. So in flexion, the head of radius fix into the radial fossa, whereas the coronoid process will fit into the coronoid fossa. So these are the articulations in the elbow joint.